Thank you everyone for joining us for today's webinar, Pride in Policy, Advancing the Health of the LGBTQ plus community. Again, my name is Colin Welker. I use he, him pronouns, and I'm a policy analyst with the Public Health Law Center. I'm joined today by my colleague, Natalie Hemmerich, a staff attorney with the Public Health Law Center, and Gabe Glissmeyer, a project specialist with the National LGBTQ Cancer Network. The Public Health Law Center is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. It's important to acknowledge that this is the traditional homelands of the Dakota people, and we recognize that the stolen land we occupy comes with a legacy of genocide, oppression, and trauma caused by US law and policy. The Twin Cities has a resilient and thriving Indigenous population working to reclaim and revitalize the land and strengthen the community. Next slide. We believe that the work we do here at the center must be done in the service of equity. We do not believe that equity is achievable through a one-size-fits-all approach, and we strive to work to address the unique needs that each community has. Next slide. We are committed to partnering with communities and organizations to use the power of law in a way that addresses the social determinants of health, especially those who unfairly bear a greater burden, such as the LGBTQ plus population, of health inequities and other societal harms. Next slide. And just briefly, the Public Health Law Center offers free legal technical assistance, which means that we can help with legal research, policy development, implementation, and defense, and we develop publications and trainings for local communities, tribes, states, and for a national audience. We do not directly represent clients or lobby. So now I'm going to turn it over to Gabe to get into our presentation.
Awesome, thank you, Colin. So, hi everyone. I'm going to be talking about the history of LGBT tobacco marketing. So once again, here's my face. So yeah, Gabe Glissmeyer, project specialist. I work with the National LGBT Cancer Network. And at the Cancer Network, we're one of the 8 CDC-funded tobacco-related cancer disparity networks. So we're going to do a lot of work with tobacco and then also with cancer as well. So the agenda, I'm going to talk a little about who we are at the Cancer Network, talk a little bit about how marketing started in the LGBTQ community. We're going to look at a lot of different LGBTQ tobacco advertisements, which I know a lot of people like looking at. We're going to look at kind of the current tobacco use in the community, and then also talk about recommendations as well. And just for reference, I'm going to be saying tobacco kind of throughout this and not commercial tobacco, but just understand that when I talk about tobacco, I'm not talking about indigenous use of tobacco or tribal use of tobacco. It's strictly commercial use of tobacco. So who we are at the network. So we have 3 pillars that we pretty much work on. So our first one is education. So we really focus a lot on educating our community about our increased risk for cancers and kind of the need for cancer screenings and early detection as well. We do a lot of advocacy work, so advocating for LGBT cancer survivors in mainstream cancer organizations through research, so clinical trials and things like that. Then we also do a lot of training as well. So for cancer centers, oncologists, nurses, basically to just help them make sure that their departments are culturally competent and able to take care of LGBTQ patients. So that's primarily the 3 pillars that we have at the Cancer Network. But we also have other programmings too. So one of the programs I work on is the Out Proud Free campaign. So what we do is that we focus mostly on tobacco, so tobacco education and also policy. So through our education, we do a lot of stuff around letting LGBTQ people know about our increased use of tobacco products, including electronic cigarettes, our increased use of menthol products as well. And we do a lot of that education through collecting stories. So collecting stories from different LGBTQ identified people across the country about whether, they've quit smoking, whether they're current smokers, whether they're non-smokers, and they're just kind of upset about tobacco companies marketing to our community. We kind of collect all these different stories and then we deploy them in different areas across the country when there's different policies happening. And then we do a lot of advocacy work. So we'll sit on coalitions, and then we also build local partnerships with LGBTQ organizations in different key places, and then try to get them involved in coalitions as well. So testifying and things like that. And you can check us out. Our website's pretty easy. It's just our Cancer Network and then /OPF. And then Colin's also going to put a link into the chat with a get involved form if you want to learn about how to share your story with us or learn about how to make some more impacts in LGBTQ tobacco work across the country. So how marketing started. So let me just preface this by saying I've been involved in tobacco work for about 13 years now. And for the majority of that, it's actually been focused on LGBT tobacco work. And so what's been really interesting is I've given this presentation a lot, but I feel like every time that I give it, there's usually a new example, especially the advertisements that comes up. So this is something that I'm very passionate about. And I think people are usually pretty riled up at the end of it. So our story actually begins in 1985. And a lot of these documents, so most of the resources that are in this presentation are only available from the Master Settlement Agreement that happened, where we've got a bunch of tobacco documents and memos and PowerPoints and stuff like that. So the very first mention of the queer community, which is specifically the gay male community, was actually 1985. And what was happening was that Philip Morris had an email that they sent out about a indoor smoke-free ban that was happening in San Francisco. And so they were going back and forth. They were talking about how do we get gay men, especially at bars, to, make sure that they are not supporting this ban and make sure that they're on our side and making sure that this does not pass. And so that's kind of where this story begins. And so there's this memo at the time, because you have to think about, Stonewall happened in the 70s. In the 80s, we have HIV/AIDS happening. So there's this really kind of, I call it creepy memo that's kind of hidden in all of their emails, where they talk about, we have this community, we have the queer community, and somehow they've been able to change their image in a very, very short amount of time in this country. At first, people thought they were degenerates and they thought they were immoral and all these things. How do we learn from them? How should we become, a positive entity in communities and like the places that we're at? And so this was kind of how they first started figuring out how they wanted to market to the community. So how it originally started. So I don't have a degree in marketing, but I can tell you that marketing to a taboo community is definitely a risky thing. Usually what happens is that if you decide to market to a taboo community or one that people are not popular to, usually what happens is that you lose the general population or your customers that are already kind of buying your products and stuff like that. So it's risky. So, and they knew this at the time. The tobacco industry knew this at the time, and a bunch of other industries also knew this at the time. So interestingly enough, prior to tobacco marketing to the LGBTQ community, the only other industry that marketed to the community was actually alcohol companies. And the very first, I think, brand was Absolute Vodka that started in 1975 with LGBT advertisements. So very risky to do. And so what Philip Morris at the time decided to do is that they wanted to figure out how do we get into this community. So they started hiring gay marketing firms to, look at what gay men were buying, where they were shopping at, where they were hanging out. And when these gay marketing firms came back, they had these quotes of, this is a dream market, and, they're very attention starved and they're very loyal. So talking about a dream market, at the time, most gay men did not have children, so there was a lot of disposable income. And around this time, I think Wall Street Journal in the 90s published this article where they said, gay men during the 80s and kind of early 90s had about $30,000 more than the average American. And so that's a lot of money, especially in the 80s. And then when we talk about attention starved and being loyal, no one was marketing to the community. And so what they found was that, when Absolute Vodka decided to start marketing to the community, most queer people were then like, I am only going to buy Absolute Vodka. Like, they were willing to put their necks out for us, so we're going to be loyal to this brand. And so it kind of created this perfect storm where there was a lot of disposable income, but then they knew that if they jumped into the market soon enough before any other brand and company did, that they would kind of have lifelong loyalty from the community. So of course, it's this perfect storm. Of course, they want to go for it, right? The problem was at the time, the community did not like the tobacco industry. There was severe distrust in the tobacco industry, especially with Philip Morris. What they were doing at the time, especially Philip Morris, was that they were funding anti-LGBT politicians. So unfortunately for them, a lot of these companies were based in southern states that were mostly in tobacco country states, so like Virginia, places like that. So what the tobacco industry would do is that they would hear about a bill coming up that was going to take away tobacco subsidies or taxes and things like that. So they would pay those politicians to make sure that the bills didn't move or get out of Senate, Congress, anything like that. And then those politicians, unfortunately, also happen to be pretty anti-LGBT. So then those politicians would then fight against any AIDS research, funding, any LGBT rights. And so it was just this deadly circle that was happening. So finally in 1990, ACT UP, which is an HIV/AIDS advocacy organization, decided to call for a boycott. And it's interesting because this boycott wasn't just a national boycott, it was actually international. So there's a bunch of different flyers from Germany and a bunch of other European countries where they're like, you cannot buy Kraft products, you cannot buy Miller products, because those are also subsidiaries of Philip Morris, and you absolutely cannot buy Marlboro. And in these, a lot of other national LGBT organizations were backing up this boycott as well, with this great quote of, you know, corporate-sponsored gay bashing will not be tolerated. So this was kind of the mess that Philip Morris had to somehow deal with. So of course, how do you deal with this? You try to change the narrative, you try to spin the tables a little bit. So what they started doing was they started donating a lot of money to HIV/AIDS research, art programs, grassroots LGBT organizations. And in about a 6-year span, they donated over $1 million. And then during this time too, they started realizing, oh, there's LGBT specific publications as well, so newspapers and magazines. And so they started realizing, we need to take this story, we need to spin this, and then we also need to start making partnerships out of this. The interesting thing about changing the narrative is that they've never stopped giving money to anti-LGBT politicians, which would have cleared up all of this, but instead they kept giving the money to anti-LGBT politicians and then just trying to butter us up by giving us money in other places. And so this is an example of a press release that went out, and this was actually calling the end of the boycott. So the boycott lasted for a year. And so the Human Rights Campaign Fund sent out this press release, and in it, you know, they talk about how, you know, we have Philip Morris, and Philip Morris has given us all this money, and we think that they, you know, care about our community. Well, you know, the government doesn't care about us because they're still not giving us any money for AIDS research or anything like this. And there's this really fascinating quote with the executive director of the campaign where he says, you know, Philip Morris is setting an example that should be followed by every corporation and business in our country. So once again, kind of thinking about, you know, they never changed giving this money to anti-LGBT politicians. They just kind of handed us money and said, you know, like, take this and do whatever you want with it, but we're not going to stop our ways. And somehow that was the example that's positive and great for our community. So yeah, so going back to these publications that were happening at the time. So they reached out to a few of them because of course they wanted to do some print publications. So they reached out to Genre Magazine, Gay Chicago, and I believe The Advocate was the third one. So I would say everything was pretty mixed. So of course, Genre Magazine, their editor, you know, talked about, you know, this is a great thing. You're just being part of the mix and you're not being excluded anymore. So after decades and decades of being kind of social pariahs, once again, you know, you're not being excluded. And how great is that for social climate changing? And then you have the editor of Gay Chicago who talks about, you know, barriers are starting to fall, and it means that this industry takes you seriously as customers. And like, yeah, of course we're going to take tobacco advertisements. Like, you would be foolish to not take tobacco advertisements. But then not everything was super positive. So the editor of The Advocate talked about how, you know, there's not a lot of funding that goes into LGBT publications. And so when you have an industry offering you many, many, many dollars, it puts you in a beggar's position rather than a chooser's position, because, you know, you can't be picky about who you take money from, and that, you know, it doesn't feel great that you can't decide, hey, I don't want to take money from alcohol companies and tobacco companies, and that you're essentially forced to take from whoever you can get money from. So this kind of sets the stage once we get into the 90s. So now we're going to point out some of the tobacco advertisements. So this was what I think is the first LGBT tobacco advertisement or tobacco advertisement in an LGBT publication. So as you can see, nothing really special about it. It's menthol, they're light cigarettes. What's really interesting about Benson and Hedges is that Philip Morris wanted Benson and Hedges to be the gay brand. So they marketed it to specifically gay men. They did focus groups about this brand. And what's really interesting is that they found that gay men actually did not like Benson and Hedges. They didn't like this branding. They thought it was really uppity. They thought it was really posh, and it just didn't resonate with the community. So this was not a very popular brand amongst gay men. And then a couple of months later, we get the second one. So as you can see, totally different. So first one had no people in it. This one is kind of very sexual because of course sex sells. So in it, you know, get the edge over any menthol you're smoking now. So once again, still pushing menthol cigarettes in the community. 93, we get Virginia Slims. These ones are really fascinating in that it plays off this trope about women who love women, where, you know, they're just best friends, they're just gal pals, like they're not dating, they're just, you know, really, really good friends. So, you know, this line of women aren't opposed to a good line, it all just depends on what it's attached to. Or this one, if you always follow the straight and narrow, you'll never know what's around the corner, like your best friend who's right around the corner and behind you. These ones are really fascinating. This is 1995. These are comparison ones. So Rolling Stone, this is Parliament. And so with these ones, they're identical advertisements, except one thing's different. And you can obviously tell what's different in them. So in the one that we have in Rolling Stone, if you draw a line from the guy's eye to the lady who is in the pool, pretty much goes directly towards her. But in the Out magazine one, what they've done is they've kept the guy and the girl there, but they've added this third person. So this guy is now just looking at this other guy, but now you can draw a line pretty much from the girl or to the other guy. And so what this is called in marketing, it's called gay vague. And pretty much what it does is it makes you question someone's sexuality in an advertisement by adding or taking away another person. And so now you're kind of like, oh, is he straight or is he gay or is he bi? I'm not sure. And so they only posted these ones in Out magazine. They didn't, of course, put these ones in Rolling Stone magazine or Cosmo or any other general population magazine. And now we're in 95. So at this point, you know, Philip Morris has been kind of taking over the gay market. But at this point, RJ Reynolds wants in on some of the action. So what they did is they created their campaign called Project Scum, so subcultural urban marketing, lasted for about 2 years. And the whole purpose of it is that they wanted to introduce Camel products into the gay community. So they specifically wanted to go for the rebellious Generation Xers and street people, which is what they called people experiencing homelessness, which is not a great way to call them. And this campaign focused a little bit differently than the Philip Morris campaign. This one actually wanted to focus less on tobacco advertisements and more on sponsoring gay events like pride festivals, bar nights, those types of things. And so, yeah, so this one worked out a little bit differently, but then eventually they also started doing a lot of advertisements as well. So this one, since it's 2000 in San Francisco, so they had a Pride booth where they're passing out different products, and they also had a lounge event as well. And they had breakfast available after Pride. I don't know if you've ever marched at Pride, and then afterwards you're usually just very thirsty and very hungry. So of course, you know, being able to have free breakfast with Camel at their lounge and, you know, maybe try a new product, that sounds really awesome. And so, yeah, they have these types of activities going on where they knew to go where the community was at. And then the next year, GLAAD, I think yearly they do a awards program where they recognize different advocates across the country. So this year, they had a little awards program, And so Lucky Strike actually had 2 different ads in this one awards program. So this one, it's called Shows That Weren't Nominated. And so pretty much from the really tiny text, it talks about how it's this boy who's coming out to his parents and he's really nervous about it. And his parents are like, oh, we already knew. And like, we're already involved in queer organizations and we're super active and all these things. And it's totally fine with us. And it's talking about how, you know, those aren't the queer stories that we get to hear about in TV shows, in movies, and in general life as well. So, and then once again, they had a smoking lounge at the dinner that year for the awards program. And then in the exact same awards program, whenever someone yells, dude, that's so gay, we'll be there. And then thanking GLAAD for letting them be a part of the event and having that smoking lounge there as well. This one's 2003. So this was posted in the Out Magazine and the Advocate. This one's really fascinating. Usually people see this one and they're like, there's nothing about this that is queer. There's no, like, nothing shouts at me that it is queer. What's really funny about this is that it's pretty hidden. And so what you'll see is that usually with American Spirit, around this, it's usually yellow. But then on this one, it's actually a rainbow. And so it's very, very hidden. Of course, focal point, it's a triangle, so it goes down to this one. But yes, they did do a rainbow on this one. 2005, American Spirit again. This was around the time, you know, of a lot of marriage equality things, people talking more about civil rights in the LGBTQ community. So, you know, they post this thing about, you know, having the freedom to do all these things. So to choose, to marry, to disagree, to inhale, it's all good. Like, it's all good with us. So once again, capitalizing on a social justice problem in the LGBTQ community. 2011, this is Lavender Magazine, which is popular in the Twin Cities area. And so they posted this in there, take pride in your flavor. And, you know, we talk about smoke-free, spit-free, drama-free tobacco. And then, of course, there's this lovely rainbow at the bottom of it as well. So once again, and these things usually show up like June 1st to about the end of June. So just in time for Pride Month. Facebook kind of threw a wrench in being very, very different with social media, obviously, because a lot of these previous ones were in publications, so print publications, but then Facebook and social media definitely changed the game a lot. So Enjoy, which is a e-cigarette company, you know, they posted about, you know, happy Pride and take pride in all that you do. So yeah, once again, reaching kind of a larger audience than those who would buy magazines or newspapers. 2016, Blue Electronic Cigarettes, they created their Just You and Blue campaign. What's interesting about this one is that on all of their social media, on their websites, they have this image of a drag queen and kind of just drag queen vernacular and lingo that drag queens use. But this was all going out to general population. So this wasn't specifically focused on the LGBTQ community, but it was using imagery that's connected to the community and not necessarily associated with the general population. And then this one, thank you to the Association for Non-Smokers Project Watch campaign. So this is a direct mail piece. So this is something you get in the mail with coupons in it. And this is from Marlboro. And what's fascinating about Marlboro is that it's one, the most popular brand in the world. Two, it definitely was not Philip Morris's intended brand for specifically gay men. But when they were doing those focus groups back in the 80s and the 90s, what they found is that, yes, gay men do not like Benson and Hedges, but they really like Marlboro. And what they found is when they started probing a little bit more about, you know, why do you like Marlboro? They were like, oh, because the Marlboro Man is hot. And so, of course, once again, sex sells. And so the problem was that Philip Morris did not want Marlboro to be connected to gay men, especially because at the time they were like, oh, gay men are the opposite of masculine, so we do not want Marlboro Red to be seen as being an effeminate brand. But then at some point, I think they had a gay marketing firm just be like, you know, like you're getting a lot of money from gay men, specifically because of the Marlboro Man, so you kind of need to just run with it. And one of them actually said, the Marlboro Man is the ultimate stud and maybe a great one-nighter. So that at that point, Philip Morris was actually okay with it. They definitely don't have anything that is outwardly, has rainbows on it or anything like that. But a lot of their advertisements, like this crotch shot and some other advertisements that they have as well, do kind of feel more like Brokeback Mountain, homoerotic in some ways. So they do kind of know who their clients are in that way. This is an email that I got last month. Wow, yeah, this was last month from Camel. So once again, and they love doing web series on their website. And so they had a drag queen, Bambi Banks, who was featured on there, talking about, the history of drag and what it's like being a drag queen. And so, yeah, so once again, pushing this out right, I think 2 days before Pride Month hit. And then most likely once July 1st hits, it will be like, we forgot all about the queer people. And then what's fascinating, this one I took actually a couple of days ago. So every year the Human Rights Campaign does their equality index where they look at different corporations and industries in the US, and they basically rate them on a scale from 0 to 100 on how well they treat their LGBT employees. And so back in 2017, I think Altria got an 85%. And this year was the first year a tobacco company has ever gotten 100%. So that's pretty shocking, knowing kind of the history of, them giving a lot of money to anti-LGBT politicians, them really not caring about our community at all, and really just seeing us as kind of dollars at the end of the day. It's super shocking to see a score of 100% of yes, you 100% care about your LGBT employees. So yeah, so this is super shocking. And then I actually got this over, I think on Friday, but the Hill's doing their like LGBT summit talking about, social justice issues in the LGBTQ community. And what's interesting is I was looking down at the sponsors, and who's a sponsor? Philip Morris International. So once again, trying to get themselves involved in our social justice causes, and kind of just being very pervasive about it as well. But I think what's interesting about this one is that a lot of the times they will use their Altria name, but for some odd reason this time they decided to use their PMI name instead of the Altria name. So yeah, so obviously, coming from 1990 and having that boycott, that international boycott, to now where it's like, oh yeah, you can host this summit for us where we're talking about LGBT issues, or yeah, you can, you're great to your LGBT employees. So we're going to forget like everything that you've done kind of over, these past 30 or so years. Obviously the tides have changed a lot. And what's fascinating is that back in the early 2000s, some researchers from the University of California did a research study to see, what did queer people, back in the early 2000s think about the tobacco industry at that point. And what's fascinating is that, they talked about a lot of things that are still kind of problems now. So one person mentioned, they found a group that's more likely to smoke, and that's fine. There's some people who will wear Nikes over Adidas, and, if Nike wants to market to those people, that is totally fine. And if they don't want to market to the people who wear Adidas, that is fine. Like, they're a business. There's nothing unethical about it. You either choose to buy their products or you don't choose to buy their products. So a lot of it was just kind of like personal choice, and they can market to whoever, but it's your ultimate choice on whether you actually use the products or not. There was a lot of talk in this research study and focus group about how, without Philip Morris, really taking that risk and marketing to the queer community, that we'd basically be like living in the Stone Ages at this point when it comes to social climate and cultural change. And so, Philip Morris paved the way for Subaru and all other companies to follow. So once again, remembering that Absolute Vodka was the first company or brand to market to us in the 1970s, and then Philip Morris, and then a bunch of other tobacco companies So they're not wrong in this, but once again, this kind of idealization of, you know, they really stuck their necks out for us, so we're not going to turn our backs on them. So bringing up this kind of lifetime loyalty that you get when you do really stick your necks out for a community that does need that kind of social support. And then this last one, you know, shouldn't we feel in some way feel sort of good about being a target market? So, you know, like our images are on all these places that they usually want to be. We're being represented in ways that, you know, people didn't want to represent us. And now there's this industry and company that wants to, you know, show us what our relationships look like and all of these things. So shouldn't we feel good about that? Like, why is that a negative thing? And so once again, I think kind of stacking on this idea of, you know, personal choice on whether or not you want to use tobacco products, and then also you know, paving the way for other companies. So once again, moving social climate ahead of its time. And then also, you know, just like feeling good about, you know, there's not a lot of representation, especially positive representation of LGBTQ people. So if we can get it, like, isn't that good enough for us? And so these are kind of the changing tides that have happened in the past 30 years. So now where does that leave us with current tobacco use? So current tobacco use, of course, in the community is not that great. And I had to split this up into LGBT communities and then trans communities, which are the next ones. So typically we smoke about 2.5 times more than the general population. So usually general population floats between about like 12, 14%. We're usually somewhere between like 20, 27% or so when we use tobacco products. Most smokers begin using tobacco products before the age of 18. It's really interesting in some focus groups talking to LGBTQ former smokers or current smokers. A lot of them will talk about how they actually had their first experience with tobacco products, usually around the age like 9 or 10. So even younger for LGBT identified people. We're more likely to smoke menthol cigarettes. This should come as no shock, seeing as the majority of the advertisements I showed you were actually for menthol cigarettes and menthol products. And then we're 5 times more likely to never call a quit line. It's really difficult, especially when you have to worry about the cultural competency trainings of the people that you're calling, you know, whether or not you bring up certain things that actually might have influenced you starting, which might influence you quitting. And if you don't feel comfortable, you'll just never want to call. So yeah, so this is definitely a problem, is getting our community members to call the quit line. When it comes to trans communities, we do not fare any better. So trans tobacco data is definitely far and in between. So this 35.5 rate is actually from 2015. There was a national trans study that was collected then, but a lot of tobacco surveys, anything like that, don't ask about gender identity or sex assigned at birth. And so we just kind of lose data every year. So I've seen ranges as far as, you know, this 35% up to 75% for the trans community. If you're uninsured and you're a trans person, you're 4 times more likely to be a current smoker. That makes perfect sense if you think about stress levels, mental health, you know, not being able to access hormones, surgeries, being able to just go to the doctor in general. You're more likely to have stress, probably more likely to be a current smoker. And then trans people also have a higher use of cigar use as well. And then vaping in the LGBTQ community. So over 1/4 of LGBT youth are using electronic vapor products. And then of course, getting addicted to flavored products because of that. And then the CDC has said multiple times that vaping is definitely an epidemic. Last year, a researcher in California did some research about trans youth in California and their likelihood of vaping. And they actually found that Black trans youth are actually 6 times more likely to vape than white cisgender youth, and then 3 times more likely to vape than white transgender youth. So that's a huge problem, especially because there's a really big misconception that the people who are using electronic cigarettes the most are white cisgender youth, and it ends up being not the case. So once again, with more data, we're able to kind of find out those things. And of course, there's evidence that, when you start vaping, that they're more likely to also switch to cigarette use or just dual use, so using both of those products at the same time. And we have to talk about stigma, because this is, as much as this is a story about, the tobacco industry marketing to the community, it's really also a talk about, stigma and social climates changing and acceptance. And so with this one, they found that LGBT people who had higher levels or higher rates of smoking were more likely to experience higher levels of discrimination or stigma. And then those that actually were less likely to smoke or didn't smoke as often actually had lower levels of discrimination and stigma. So we need to kind of talk about the impact of social stigma, discrimination on these kind of higher smoking rates. Adding to the problem, we definitely do not rate it as an important health issue. So if you ask anyone off the street, what's the top health issue in the LGBTQ community, probably 9 times out of 10, people will say HIV and AIDS. Probably the other one will probably be mental health and suicide. So we just don't rate it as an important health issue. I think a lot of this comes down to, the personal choice of it. Plenty of people don't smoke. And so the people who do smoke, it seems like a personal choice that they decided to make. But epidemiologically, it is our #1 health issue. Every year, roughly about 30,000 LGBT people die from tobacco-related health issues. So that is a huge problem, because those are 30,000, queer voices that we lose. And then we also historically have less access to LGBT competent healthcare, mental health care, things like that. So we're not able to take care of our physical health, our mental health, and those other things that kind of, on top of, this targeted marketing, that kind of push us more towards smoking being the option for stress relief. And what's changed? Obviously, a lot has changed in 30-something years. We obviously have social media. So social media was not around during the Master Settlement Agreement, nor in the 80s. And so we have Facebook, we have Twitter, Snapchat, TikTok. What's really fascinating about this is that most of the tobacco main companies don't have social media, but a lot of their subsidiaries and brands do. So like General Snus, I think, has Twitter and Facebook. Juul has TikTok and a bunch of these other things. But what's the main problem with this? That you usually only have to be 13 years old to join any of these. So even though they're official websites, you have to be 21 years old to be able to get on there and see any content. On all of these ones, you pretty much only have to be 13. Even though on all of them, they have a warning that says like, oh, you have to be 18 to view this. We've all been 13 and 18 before, and like we all lie about our age. So it's no surprise that probably 13-year-olds are lying about their age to see what Juul's posting and what General Snus and all these other brands are posting as well. There's video streaming commercials. So I know Hulu is definitely one of those companies that has commercials. And there was actually a research study that showed that if you were an LGBTQ identified person, that you were actually more likely to see a tobacco couponing ad on video streaming services than non-LGBT people. And so, yeah, I definitely remember the first time I saw, I think it was back in 2016, Blue e-cigarettes I had the drag queen commercial, and I was like, oh, this is really interesting. And then it got to the end and I was like, what's happening right now? Like, this is a tobacco company. So yeah, so very shocking, but yeah, we're more likely to see it on video streaming sites. And then just understanding, obviously, we're not a taboo community anymore. So we're here, we're queer, and we're staying. We're not going anywhere. Obviously, we've established ourselves as having a lot of markets in our community, but I think a lot of it is also we're focused on the social justice aspects of it and intersectionality. So making sure that queer people of color, BIPOC people, all are able to achieve health equity as well. So yeah, we're here and we're definitely not going anywhere. So some recommendations. So include LGBT people on your tobacco coalitions. I shouldn't have to say this, but I surprisingly do. So yeah, if you know there's a tobacco coalition going on in your city or your state, make sure that there's LGBTQ people at the table. I can't tell you how often, something's about to pass or there's some emergency thing And then suddenly someone's like, oh, we should have queer people here. And it's like, oh, this sucks. Like, of course it sucks being invited to the birthday party, 10 minutes before the party starts. So make sure from the beginning of the coalition that you make sure to include LGBTQ identified people. Having LGBTQ specific quit line, cessation prevention materials is really important. Once again, going back to positive representation, if the tobacco industry is using positive representation of our community in their advertisements, we also need to do the same thing on cessation and prevention materials as well. And so, yeah, so kind of like these examples at the bottom, making sure that people are able to see themselves reflected in any materials that you create. And then remembering that tobacco is at the forefront of our minds. I know that this past year, there was obviously a lot of tobacco policy happening in a lot of different states, but I think every state also had anti-LGBT bills, anti-trans bills happening. So pretty much every LGBT organization was inundated with, trying to protect, their right to be able to go to the bathroom where they needed to, where they wanted to get like healthcare. All of these things were happening that were really much life and death. And so just remembering that tobacco isn't at the forefront of our minds. So even if we're tobacco advocates, all of these things, just understanding that sometimes there's other things that seem more important, and that we have to be respectful of that, and that we have to, make some compromises there. And so just keep that in mind. And then of course, going back to stigma and discrimination, this is probably the biggest point, just understanding the importance of reducing stigma and discrimination to improve health equity overall. So making sure that people have access to healthcare, access to mental health care, have strong social supports and networks, and making sure they're able to positively see themselves represented in materials and all of those types of things. So I am going to turn it over to Natalie.
Thanks, Gabe. I appreciate everything that you shared. And I was just going to talk a little bit about policies and things that we can do from a policy and legal perspective around commercial tobacco regulation and policy to help improve the health and health equity of the LGBTQ plus community. So first, I think Gabe talked about this, and it's important that I'm showing sort of the same advertisement as Gabe did about flavored products and the targeting of LGBTQ plus community. And Gabe mentioned the data about menthol use being more prevalent in the LGBTQ plus community. And it's been a hot topic recently because the FDA recently announced that it plans to ban menthol in all cigarettes and flavors, including menthol in cigars. And this undoubtedly will have a huge public health benefit for many communities that are marginalized and targeted by the industry, including the LGBTQ plus community. And unfortunately, as Gabe mentioned, there's not nearly enough research or data into the health benefits or the health risks for the LGBTQ plus community around menthol and flavors. But we do know that the community has a higher prevalence of smoking and especially a higher prevalence of menthol use. And so undoubtedly policies aim to reduce the availability of flavors, especially menthol, undoubtedly will save LGBTQ plus lives. And because we know that the Black community also has a higher prevalence of menthol use from an intersectionality perspective or intersectional perspective, people who are both Black and a member of the LGBTQ plus community are most at risk of the health harms from smoking menthol cigarettes. So these policies protect many marginalized communities. And so what we know is that many communities and a handful of states have passed these policies. And the most comprehensive policy is a policy that bans all flavors and all commercial tobacco products. So capturing not just cigarettes, but also what Gabe was mentioning with snus as pictured here, and also e-cigarettes and products like that that have also been marketed to the community. And we know, though, that one of the common concessions that communities make when they pass these policies is to exempt menthol. And that only perpetuates the health disparities that we're talking about. So one thing that we can do is, as an LGBTQ plus community, is to advocate for comprehensive policies that ban all flavors and all tobacco products, and that will undoubtedly advance health equity. And like I mentioned, the FDA recently announced that they will take action to remove menthol cigarettes and all flavored cigars from stores. However, that action is likely to take a while. So I'm giving a rough estimate of 2 to 5 years, and perhaps even longer if the industry sues. And the industry is likely to sue because they are litigious. And the announced action does not include all flavors and all policies. So it's not comprehensive. So it's extremely important that we keep advocating for local, tribal, and state policies that are comprehensive. Next slide. And then the other policies that we can work on and work to advance are policies that are more directed specifically at the community. And some examples of those are adopting comprehensive smoke-free and commercial tobacco-free policies, including rejecting industry sponsorships at pride festivals. And other examples that we could adopt policies like that or pursue policies like that are at LGBTQ plus community centers and in multi-unit housing. All those scenarios would help advance the LGBTQ plus community health as well. Next slide. So we are leaving time, just enough time, I think, for questions, which is exciting. So about 13 minutes. And this is our contact information. I mentioned a little bit about the FDA, possibly pursuing or should be pursuing prohibiting menthol and that being a really important policy. So if you go to our website and you sign up for our newsletter, you'll see like opportunities to engage in that as a public and to advocate for that as a public. But also you can find our contact information here and get more engaged with the work that we're doing. So we can do questions now. And I think we have quite a few. So thank you for engaging and asking questions.
Yeah, thanks for everyone who provided a question. So I'm just going to go through a number of them. We have quite a few, so let's try to get to them all. One of the first ones we got is, can you comment on increased smoking on drama shows or television shows like Pose and Sense8? And there's so many others. So what can we do about the normalization of smoking among queer folks?
Yeah, that's a great question. I know historically that's also been a really big problem, especially back in the early 2000s with, like Lady Gaga, Lana Del Rey, and a bunch of other, gay icons, popular singers who were smoking. And I think, what can we do about it? I think a lot of it is about, once again, representation. So having representation where, we're not smoking, where we have, those positive role models who are like, yeah, I understand it's commonly used as a stress reliever, but actually I'm choosing to, like do yoga, or I'm choosing to go on walks or something, or read, who knows what else. So I think a lot of it is just that positive representation and not having a lot of those, outwardly queer people who are willing to kind of go to bat for the community, especially for queer youth. But yeah, I'd say a lot of it's just representation and increasing it.
It's worth mentioning too, and I always mention this, that nicotine is not a stress reducer. It's a stimulant. So it doesn't reduce stress, although it's been perpetuated as a stress reducer and people think that it's a stress reducer. And so really breaking that mentality too is really important. The sort of stress relief you get from it is when you go ahead and feed the addiction and release your cravings for it. But that, disrupting that in your mind is like, this will help me de-stress is important too.
Another question that kind of goes along those lines is, someone asked if we could please talk about marketing electronic cigarettes as harm reduction devices, particular to the LGBTQ plus community.
Oh, yeah, it's harm reduction. I haven't Unfortunately, I haven't seen much as far as research goes about harm reduction, specifically in the LGBT community, when it comes to electronic cigarettes. I know that one very popular thing, I was actually just talking to someone yesterday who mentioned that, you know, at Pride festivals, a lot of the brands who, even though they can't have booths, they will just kind of be like outside of Pride festivals where people are coming in or going out, handing out samples. And so, and it's usually electronic cigarettes that are being handed out, of course. And so, but as far as harm reduction, I haven't seen much as far as research goes, but I think that's definitely a interesting avenue to look at.
Another question we got, Gabe, is what tobacco cessation methods have been the most successful in LGBTQ communities?
Yeah, that's great. Wow, what a heavy-hitting question. I mean, I would say first and foremost, it depends on the community. I think always coming from a non-shaming aspect is definitely the best thing you can do, just because, you know, as queer people, we tend to face kind of lifetimes of shame and guilt. And so usually the worst thing you can do is just add on to that guilt and make people feel worse about what they're doing. And so, yeah, so I'd say just, you know, anything that's shame-free, really empathetic, understanding, you know, that, like the history behind it, the marketing, the, you know, just not having access to mental health care, all of these other things play a role in it. So I think once people kind of come to that understanding and helping people quit in that way, it's usually pretty successful. Yeah, and I know there's tons of great models throughout the country that have really successful models doing similarly to that.
Yeah, I think it's important too, just to kind of piggyback off that about the intersectionality of LGBTQ folks and homelessness or addiction and those things, and those play into tobacco use rates as well. Another one, this is a good question. Our project works on smoke-free bar patios. Given the historical connection between bars and the LGBTQ plus community, support, isn't that a high priority for policies related to tobacco use?
Yeah, I think that makes a lot of sense. I don't know that we've ever been asked necessarily to draft something like that. So it's really cool that your project is working on that. And if you would like free legal technical assistance working on that, we are happy to collaborate and support that work. And I think that I don't mean to highlight some policies or not others to some extent, but you know, when you're thinking about like specific place policies, sometimes those are a little bit more, you know, there's like a time and place that people can't use it, and it's maybe not quite as effective as something as like truly like eliminating the most used product all across the United States. Like that's that. So I'm highlighting that as a more impactful, what I think is a more impactful policy. And like I've highlighted the dearth of research that's actually there to tell us all these things, but all of those policies are really great too, that, you know, impact the community and you reduce the social aspect of using commercial tobacco in the community, which is a huge driver too.
We have another policy question here, and we have time. So there are mixed positions among LGBTQ serving organizations in this person's state about ending the sale of flavored tobacco products. One side is worried about taking away short-term coping strategies for trans youth who are experiencing discrimination and depression. What policy recommendations do you have for us to address this very real concern while also ending the sale of flavors?
Well, I mean, we've always talked about this often, like funding. We need funding for not just quit line service. I mean, we're underfunded on all kinds of tobacco recovery, nicotine recovery services, but supremely underfunded when it comes to specific communities that really have unique needs. And so advocating that more of the budget, you know, like your state representatives and your state legislators, to allocate more of the budget to funding and to earmarking it to specific communities, or to organizations that are working with specific communities to try to bring about these changes, is really important. And that's not something that's always written into like local policies. It's typically not as much funding there, but I mean, that's something that could be pursued or thought about. But it's usually about state budgets, and specifically since you were talking about state budgets. And I totally hear that perspective. And my pushback is just that what are we saving them from if we're signing them up for a lifetime of addiction, that they're going to die a horribly painful, I mean, they're like very likely to die of a painful, horrible death or have really significant health issues when they get older. I mean, I don't know. It's hard to, you know, allow youth whose brains are not completely developed to be making decisions that are like lifelong decisions. And so that's kind of my pushback, but I understand. I don't know what the exact policy answer is besides more funding and more push towards that. And Gabe, I don't know, you're welcome to comment on this too.
Yeah, I'd say kind of from the flip side of less, I guess, still on policy, but less on tobacco. I think this is also important for why we need tobacco advocates that are also advocating for policies that help increase health equity, help increase, you know, or decrease, you know, stigma and discrimination. So whether that's like on the federal level, state level, anything like that, because I think, you know, especially trans youth, they were kind of the you know, the ones, and a lot of these anti-trans bills, they were the ones who were going to be suffering the most this past legislative session. So yeah, so I think, you know, I think as tobacco advocates, as public health people in general, as just like concerned citizens, who knows who else, but I think we also just have to understand, you know, really decreasing stigma, discrimination, homelessness, increasing mental health resources, all of these things play into these policies at the end of the day. So even if we, you know, ban all flavored tobacco products federally, we'll still have people, you know, struggling, being bullied, all of these things. So we need to make sure that we take care of the intersectionality of these problems, because it's not just one issue, it's multiple issues.
And I think it's worth mentioning that, you know, states generate revenue from taxes. They can increase the taxes, which actually have good public health outcomes, and they generate revenue from them. And typically that goes just into the state coffers. And so that's like the place where I'm talking about funding and getting that earmarked and getting that specifically directed. The money that they do get from the industry already, and directing that directly towards this work would be really impactful. I think
we have one more.
Oh, wait.
One more question, maybe for Gabe here. Why are tobacco companies allowed to market to the LGBTQ plus community?
Because they can, because it's an industry and they have, you know, freedom of speech, or I guess, yeah, freedom of speech, I guess it's First Amendment rights. So we can't tell them, you know, if they slap a rainbow on something, we can't be like, oh, you can't use this, because then they'll turn around and be like, oh, but like Nike used the rainbow, so how come they get to use a rainbow but we don't? And so that's why ultimately. And yeah, they've been doing it for a long time. I think they've, you know, managed to change their image enough in the community that now they're a pretty not super accepted part of the community, I'd say, in certain parts of it, but I think for the most part, you know, it's that funding piece. Like they're willing to drop, you know, $1 million to have their name on a pride flyer, and it's like, imagine the amounts of things you can do as a grassroots LGBT organization with $1 million. It's pretty much, it's a no-brainer why it's such a struggle to cut those ties. And so that's kind of why they pretty much just saw an opportunity. They did the same thing with the Black community as well. They saw a community that wasn't being marketed to, they decided to do it, and then we kind of get to live with the consequences of that now.
Great. Well, thank you, Gabe and Natalie, for sharing your expertise. We're at time, so I'm going to wrap up the webinar, but please take a moment to fill out the evaluation and feel free to contact any of us with questions. And the webinar will be available in about 24 hours on the internet for your viewing. Thank you, everyone.